Welcome to NCLEX Map. Today we push your clinical judgment to the highest level using 4 fundamental skills: vital signs, head-to-toe assessment, aseptic technique, and medication administration routes. Each question is crafted to challenge your reasoning the way the real NCLEX will. Listen closely, think clinically, and analyze every cue. In our first scenario, you walk into a room and find a post-operative client who suddenly becomes restless. Tachypneic at 32 breaths per minute. Heart rate 118. Blood pressure 92/58. Pulse oximetry 87% on 2 liters nasal cannula. The NCLEX question asks, what is your priority action? A. Apply a non-rebreather mask. B. Increase the IV rate. C. Assess pain. D. Elevate legs above the heart. The correct answer is A, because a sharp drop in saturation with acute restlessness indicates early hypoxia, and immediate oxygenation preserves tissue perfusion. Pain assessment is important, but not before oxygenation. Increasing IV rate or elevating legs delays correction of the most critical threat to life. Next question from the head-to-toe assessment. You evaluate a patient with new onset confusion, unequal pupils, left arm weakness, and irregular respirations. Options are A. Check the glucose level. B. Begin stroke protocol. C. Lower the head of the bed. D. Reassess in 5 minutes. The correct answer is B, because unequal pupils and unilateral weakness signal acute neurologic compromise requiring rapid stroke activation. Although glucose check is essential, the first, best, and most time-sensitive action is to initiate the stroke pathway. Never delay neurologic emergencies by reassessing later. Now move to aseptic technique. During a sterile dressing change, the student nurse reaches over the sterile field to adjust the light. The instructor asks, what is the correct action? A. Continue the procedure because sterile gloves were intact. B. Replace only the gloves. C. Discard the field and re-establish sterility. D. Ask another nurse to finish the procedure. The correct answer is C. Reaching over a sterile field contaminates the entire setup due to airflow disruption and potential droplet contamination. Gloves alone cannot preserve sterility once the field is compromised. Another challenging asepsis question. You are preparing a sterile catheterization tray. Which action indicates immediate contamination? A. Holding the solution bottle 6 inches above the field. B. Touching the 1-inch border. C. Allowing sterile gauze to touch the drape's edge. D. Placing equipment on the center of the field. The correct answer is C. Anything touching the 1-inch contaminated border becomes non-sterile. Many students mistakenly choose B, but touching the border itself is not contamination. It is expected and neutral, but allowing sterile items to contact that zone breaks asepsis. Now advance to medication administration routes. A patient taking a buccal medication suddenly swallows it with water. Which action is correct? A. Offer another tablet immediately. B. Notify the provider because dosing may change. C. Document as given because medication was ingested. D. Instruct the patient to rinse the mouth. The correct answer is B. Buccal medications bypass first-pass metabolism. Swallowing changes bioavailability and requires provider notification for safety and efficacy. Another high-level medication route question. You prepare to administer ophthalmic drops. Which finding requires you to hold the medication and reassess? A. The patient's head is extended. B. The conjunctival sac is visible. C. The client blinks rapidly during application. D. The dropper accidentally touches the eyelashes. The correct answer is D. Once the tip touches any surface, sterility is lost and contamination risk becomes unacceptable. You must replace the bottle or follow facility protocol before continuing. Now integrate all 4 domains with a combined clinical challenge. A febrile patient reports dizziness, shows blood pressure 88/46, heart rate 135, respirations 28, oxygen saturation 92%, cool skin and delayed capillary refill. During the head-to-toe exam, you note dry mucous membranes and a faint rash. Which action is priority? A. Administer oral fluids. B. Start a large bore IV and prepare fluids. C. Give antipyretics. D. Apply nasal oxygen. The correct answer is B. This patient shows early septic shock, hypotension, tachycardia, tachypnea, poor perfusion, and altered temperature control. Oral fluids are unsafe, antipyretics are secondary, and oxygen may help, but will not correct circulatory collapse. Perfusion must be restored first. Final question brings together medication routes, asepsis, and assessment. You prepare to apply a transdermal patch of nitroglycerin. Which finding makes you stop and reassess? A. The old patch is still in place.